Priority Setting in Tuberculosis Program Planning, a Policy Brief. In a world where limited funds could mean the difference between saving thousands of lives or watching tuberculosis, TB, claim yet another victim, the art of smart resource allocation isn't just important, it's a matter of life and death. This is the urgent reality facing global health leaders today, as they grapple with shrinking budgets and the relentless challenge of ending TB. But what if we told you that there's a way to navigate these tough choices with precision and compassion? Keep reading to discover how strategic prioritization can turn the tide in the fight against this ancient scourge. Overview. With financial constraints tightening like a noose around the necks of public health programs worldwide, the need for savvy decision-making in tuberculosis, TB, initiatives has never been more pressing. TB, a contagious bacterial infection that primarily affects the lungs but can ravage other parts of the body, demands that nations make savvy choices to distribute scarce resources wisely, amplify outcomes, avert preventable fatalities, and build momentum toward eradicating TB once and for all. This policy brief serves as a valuable companion to the World Health Organization's WHO Guidance for National Strategic Planning for TB, available at https://www.who.in/publication/I/item/97892400520055, providing actionable methods for establishing priorities within a country's TB efforts. For beginners, think of TB as a sneaky adversary that spreads through the air when infected people cough or sneeze. It's treatable with antibiotics, but without proper planning, it can flourish in underserved communities. The brief underscores approaches rooted in solid data, focused on human needs, integrated with wider health objectives, and backed by robust governmental oversight with input from diverse partners, including NGOs, communities, and international organizations. Drawing from real-world examples, such as how countries like India have successfully combined data analytics with community involvement to target high-risk groups like slum dwellers or migrant workers, the document lays out the foundational rules, step-by-step procedures, and real-world factors for successful priority setting in TB program design. It also offers clever tactics to overcome funding hurdles, ensuring that essential TB services, like free diagnoses, medications, and support for those with TB, remain accessible and effective without interruption. But here's where it gets controversial. Should we prioritize funding based solely on numbers, like infection rates in densely populated cities, or factor in social justice, giving extra weight to marginalized groups who might not show up in the data? This is the part most people miss in TB planning, the ethical dilemmas that pit efficiency against equity. What if diverting resources to prevent outbreaks in wealthier areas means slower progress for rural tribes or prisoners? It's a tough call that sparks heated debates among policymakers, and we invite you to weigh in. Do you believe data should reign supreme, or should compassion for the underserved guide our decisions? Share your thoughts in the comments below. Agreement or disagreement welcome, as this could redefine how we tackle global health crises.